Hello there. Thank you guys so much to my replay viewers and to my catch viewers and all of my web viewers. I thank you guys so much for joining me. Cole Ladybug, thanks for joining. So, a long weekend, and we're back on Monday. For those of you who are our regular viewers, we have changed our scoping times to Monday, Wednesday, Friday, and it's 7 p.m., same time. And so I've been doing a little bit of my self-care journey. Thank you for joining, honey. I've been doing a little bit of my self-care journey. Well, thanks for sharing, baby. I'm on, my self-care journey and being an example as to how we can continue to put ourselves first and to do the hard work and make the hard decisions about putting ourselves first. And so, for those of you who are new, however, my name is LaShawn Wilburn. I'm the founder of Hamaji. We are a nonprofit out of Houston, Texas. We support mental health family caregivers who are supporting their loved ones, and we help them to customize their care demand schedules and their care demands so that it fits them and their families and makes their journey a great deal more manageable. We're not looking for perfection. We know that doesn't exist. There's too many ups and downs, ebbs and flows in the journey of a mental health caregiver and as a mental health survivor. Speaking of which, I'm a mental health survivor myself, okay? In addition to being a mental health family caregiver. So, with that said, today I actually did a blog, and Monday, Wednesdays, and Fridays is when I do my blogs. So if you guys ever miss this scope, you can always go over to our page at hamaji.org and check out the blog, and that's what I had the discussion on that day. But you can always count on there being a scope up here, 7 p.m., somewhere around in there, okay? I try to be as on time and prompt as I can be, but sometimes that's not possible, and, life happens, so. Let me pull up my online web view so that I can see if there are any questions or if any comments come up. I'm able to, oh, Chris, look at you. You're here because you need help. Did you know we're a mental health organization, Chris? If you stay on, maybe you'll learn a little something. Okay. And that's coming up. And so, as I was saying, anytime you come on and you don't find the information that you were looking for, or you are not sure what the topic for the day is going to be like, Elo Skur, thanks for joining. And you're not sure what the topic for the day is going to be. Oh, let me turn that down. Sure what the topic are. Okay, there we are. Okay, there we go. Chris, you're welcome to stay, sweetheart. I think you really need to be here. You're welcome to stay. But if you keep interrupting with questions that are not on topic, I'm going to block you. Okay? All right. So, as I was saying, should you want to know what the topic is going to be on our on our Periscope for that day, the best way to find that out is to drop by our page, hamaji.org, and go to our blog, and it will tell you exactly what we'll be discussing for that day. Normally, the topics are centered around mental health family caregiving, but being a survivor myself, I also try to address survivor issues. I try to address the mental health family caregivers' journey from the perspective of both what happened? I try to address the mental health family caregiver's journey from a perspective of not just being a family member or a mom who's supporting a child, right? I want to also give the perspective of a survivor so that people understand that there are many challenges that the survivor, experiences that we who are, Chris, is it something you need help with, sweetheart? There are many challenges that a survivor encounters that under normal circumstances, people would see as, oh, well, that's not a big deal. That's something that you can easily overcome. But if you don't know enough about mental health or mental illness, it can be difficult to understand how to support someone. So coming on here and sharing both my testimony as a survivor and testimony as a mental health family caregiver is what I feel is a very unique blend. I call myself a hybrid because I'm able to address the needs of both the caregiver and the survivor. And so today I covered trust should be in every family caregiver's toolkit. And I think trust is one of the major factors in recovery for someone to actually be able to, let me turn that down, for someone to actually be able to reach out to their family and say, hey, I'm struggling. Hey, I'm having a hard time. Hey, I'm feeling depressed today. I'm feeling like I'm overwhelmed and I can't make it, right? For them to be able to do that, there has to be a level of trust between them and their family. For them to be able to say, I have a problem, I hear voices. I feel angry all the time. I feel moody. I don't know why I'm, having mood swings. Some people have mood disorders, right? And so for them to be able to actually come in and talk to their family members, talk to their friends, be able to say, hey, this is what I'm struggling with. Can you be there for me? That takes a lot of guts. That takes a lot of trust. And so I talked about trust from different perspectives today, from the perspective of your loved one needing to know that they can trust you as the family caregiver, right? Many times as a caregiver, we find ourselves, I'm sorry about the glare up here, you guys, but I'm scoping from a different room in my house today. Many caregivers find themselves in a position where their loved ones coming to them and telling them things that, that are confidential. And so as a caregiver, we want to be mindful of that. We want to be respectful of that, not calling Auntie so-and-so on the phone and talking to Auntie so-and-so about what was said, right? Because our loved one may have told us that in confidence. They may not have felt comfortable with that information being shared. So if we tell, their business and we talk about these things openly, then they're going to shy away from wanting to share that information with us in the future. And that could be a hindrance, right? Because if we don't know what they're, in need of, that they're suffering, that they're having a difficult time, then it makes it very hard for us to be the best support for them, right? And we want to keep that line of communication open and thereby respecting the privacy, respecting that, asking them how do they feel about, if you decide you want to talk about something amongst the family, if there's something that, they've, confided in you and you don't know if they want to share that in the family circle, right? Like we have family meetings. And so I'll ask my son, well, do you mind if I talk to the family about it? Do you mind if we put this out in the open and everybody can have some input, right? That's showing respect, because one of the things I had to learn and very early on in my family caregiving journey is that you cannot take away the rights of the individual by making decisions for them, by deciding, oh, well, they're not sound enough in mind and body to be able to make that decision, right? You want to be able to still have the respect and dignity shown to your loved one, even though they may be battling and struggling with the mental illness, right? That's what any common person would want. We're sick, but we're not incapacitated. We may be suffering from symptoms, but that doesn't mean that we can't think for ourselves under certain circumstances. That doesn't mean that all of our thoughts, wishes, and wants go out the window because, that's what you decide for us, right? And so that's very important as a mental health family caregiver, to respect our loved one's privacy, to respect our loved one's desire to remain independent and to have some things remain, confident, in confidence, all right? And so that was one subject that I covered. Another subject that I covered was trusting those who want to help. Now, this one was a very difficult one for me at least. Um, I had for the longest been the one that was, responsible for taking on the main, uh, um, all of the chores and all of the responsibility for my family, coming from being a divorced wife, a divorced mother, being a single mom, being the breadwinner, making all the decisions in the home, being responsible. If I didn't do it, it didn't get done, right? And so coming from that place, I had to learn to share that responsibility with my husband. After we got married and our family became blended and we, had to take care of our children together, then I had to now begin to trust him to be able to come on board and help me. A lot of times as family caregivers, we're afraid to relinquish some of our responsibility, some of our control. We feel like if we're the one doing the care, if we're the ones, in charge of everything, then we know it's going to get done, right? We don't want to relinquish that. Well, a lot of times that causes us to go into burnout. It causes us to overwork ourselves. It causes us to put ourselves in a position where no one can do the care in the event something happens to us. And I covered that, a great deal of that, in the last, 18 days of my 21-day program that I have for Mental Health Family Caregivers. That has been some of what we've covered there extensively, because you have to be able to trust others to come in and help you with the care of your loved one. I talk about all the time, we have dementia caregivers who, are very much concerned about bringing in a professional caregiver because their loved one may not be comfortable. And so I tell you guys exactly the steps you need to go through in order to make sure that your loved one is comfortable, because what I say is this: you can either choose to prepare them beforehand, or they can be thrust into it when you are no longer able to care for them and you're face down in the front yard, or worse yet, in the house with them, and they're incapacitated and no one even knows you're out because you haven't told anyone that what you're caring for your loved one, or that you're alone in this and caring for your loved one. Who's going to come and rescue you? What happens to your loved one? They're in the home, no one's there, and you are out cold. Okay? So those are the things I want you to think about during this journey when you start thinking about, well, you know what? I can't trust anyone to come in and help me with my loved one. I can't trust anyone who would be, um, uh, safe enough for me to leave with my loved one. There are programs you can use. There are organizations you can use that they vet the people who work for them. There are extensive background checks. You can use cameras in your house. There's a wealth of things that you can do to ensure that your loved one is being cared for properly. Okay? The next one I talked about is trusting ourselves, right? I don't think I've met a family caregiver yet who hasn't felt doubtful of their capabilities, who hasn't second-guessed their decision to do something for their loved one. We all think, did I make the best decision, especially in terms of mental health caregiving, because at certain times we have to decide whether to take our loved one to the hospital if they're symptomatic, if there's something, if there's something that, is bothering them, and we know that they are, tilting towards the level of danger, and we have to take them into the hospital. We have to be able to trust that we know the decision to make, and that if we make a mistake, as long as it's not a life-threatening mistake, and I find it very hard to believe that there's ever a caregiver who's going to make a decision haphazardly on behalf of their loved one. But we cannot feel like we can't make the best decision for our loved one, okay? In the beginning, yes, there's going to be some times when you're afraid. There's going to be some times when you're scared and you don't know what to do. It's called trial and error. And when you talk with your loved one after the fact and you explain to them, look, I'm just as confused about this as you are. I'm just as afraid as you are. And maybe not as afraid because I don't have to experience it. But I'm afraid I'll make the wrong decision and that, it will be against you and not for you. When we open up and talk to our loved ones and let them know that we are just as afraid or as vulnerable to being afraid of making a poor decision, it lets them know that we have emotions, that we care about them greatly, number one, but it also gives them a trust factor, okay? Because then they understand that this person isn't doing this because they want to control me. They're doing this because they want to help me, Okay? So learning to trust ourselves, trust our gut. Is Sierra outside, honey? Honey?
Yeah.
Is that her at the back door or is that Gunner? Sierra? Okay. That's my dog. She wants to come in, knocking at the door. And so what we want to do is, do our research, take the notes, all of the things that we want to, ensure that we are being proactive versus reactive, right? We want to be proactive. So that allows us to have a bit more trust in ourselves, right? Okay, that's my dogs coming in. That allows us to be a bit more, we trust ourselves. We trust our judgment more. We trust more that we are, capable because we have that backup of the knowledge, of the research. We have our whole toolkit that I'm always talking to you caregivers about comprising your toolkit, right? And so that's very important, trusting ourselves. Lastly, but most important, I address faith. Faith is trust. Believing in God, knowing that He won't let us down, knowing that whatever we go through, that He will provide a way out for us. It will seem like there are times when the world is coming down on you all at one time. It will seem like Armageddon is happening. What is that other one with Will Smith? What was that one? Apocalypse or something? I can't remember. But
Bruce Willis was Apocalypse.
Oh, Bruce Willis was Apocalypse. Well, it will seem like the whole world is just imploding. No, not Men in Black, honey. But it will feel like there's an implosion going, right? That you are out of control and that things are going to just, everything around you is going to be destroyed. That's my baby puppies. They were born on Christmas. So they're trying to nurse now, making noise. And so, when we get in those situations where we feel the most out of control, when we feel the most weak, when we feel the most doubtful, those are the times when breaking into prayer is a very good solution. I will break into prayer in a minute. Matter of fact, my day starts and ends with prayer. And I talk often with you caregivers and survivors about how important a spiritual foundation is for you. It is so important because when all else fails, one of the elements of mental illness is the fact that it's something, an invisible force that you are battling. It is a brain illness that, you can't see. And so we are very carnal creatures. We look at life in terms of what we can see, touch, smell, taste, hear. That's how we view something, and it becomes reality to us, which is why there are so many stigmas attached to mental illness, because a person can look perfectly fine. I mean, looking at me, you would never know I battled depression and anxiety. We look at people who have mood disorders. We look at people who have eating disorders, and unless there is some physical sign that they are suffering, we don't know, right? And so to see someone behaving in a way that is not what we consider the norm, right? To see someone behaving in a way where maybe they're talking to themselves or hearing voices or, can't breathe or can't catch their breath or having a social anxiety moment, right? It's kind of impossible. Annie, the Muse, thanks for coming in. It's kind of, difficult to kind of connect with that to a physical realm, right? It's kind of difficult. Going into prayer, and I call it my prayer warrior mode. So when you see me show up on here and I have my camo on, I think I wore my camo on Friday because honey, I was in prayer warrior mode because the devil was busy last week, trust me. And so when I get to those places, I get prayed up. I grab my Bible, I read my scriptures, I get in my word, and I get in my head and in my heart with the Lord, because I know when I can't fight that battle, when that battle has come upon a spiritual nature, I know that God is going to take over for me, okay? And so that's why I stress a lot to family caregivers to, make sure you're setting a good spiritual foundation. Make sure that you believe in something bigger than yourselves, right? Because This thing will tear you down. It will destroy families. It will destroy, jobs. It destroys relationships. It destroys parent-child bonds. It goes on and on. And the most difficult thing, I think, for me is to come and encounter a person who is so afraid of the stigma that they're suffering. They don't want to admit to having a problem. And that, for me, is the most painful thing to see. Because that person, if they could come out and ask for help, if they could get the support they needed, if they could get the medication and the therapy that they needed, they could see their life increase. They could see life whole again and not suffer. Having a mental illness is very difficult, and suffering in silence is a bad choice, bad decision. So if you're watching this video and you feel like you are having a difficult time in your life, you can't understand why, you feel angry sometimes, you feel happy other times, you maybe even find yourself struggling during the winter months when there's very little sunshine, and you may feel like, overwhelmed, you may be angry and, quick-tempered and not understand why you're going and flipping back and forth between, different emotions and isolating yourselves and cutting off people around you. Those are signs that you need to speak to someone. Those are signs that it's time to get help. As soon as from what I recall from my early journey with mental illness and depression, the first thing I did was start chopping off people around me. I had to get people from around me. All I kept telling myself was, I need to have these resources available to me, and I don't have time to spend them on anyone else. I need to try and keep focused and not feel the way I do. And so that's a bad thing to do. Don't isolate yourself. Reach out. Talk to your friends and family who you can trust. If you don't feel like you can trust them, go and see your doctor. Your primary care physician, the doctor you go to when you say, I think I might have the flu, or, I've been having a headache and it won't stop, and I go to the doctor and tell the doctor, I think I have migraines. That same doctor, you can tell that doctor, doc, I've been having some concerns about my health, and I'm worried that I may have some problems. Can I tell you what's going on? And you can help me, okay? As mental health family caregivers, we are the last to know that there's a problem, because we get ourselves so busy in our day-to-day chores and the caring for our loved ones that our health has suffered, our mental health has suffered. And before you know it, you're in the danger zone, right? That's why it's important to keep our self-care, our physical care, our mental health care at the forefront of our minds, because we don't want to get to the point where we are in the red zone already, and now what happens, right? We're in a worse case scenario than if we had gotten help long beforehand. So even if you're not feeling bad, I follow a psychiatrist here on Periscope. Her website is yourmentalhealthfirst.com. I speak about her all the time. I carry the flag for Dr. Watkins. She's amazing. She's on here on Periscope as M. Watkins, MD. She said something that was so profound when I first started watching her channel, and that was, there should be an annual mental health review, like people have an annual physical, exam. And so I'm advocating for that. You should talk about your mental health with your doctor at least once a year. Ask for a referral. Ask to be able to see a therapist. I have some things that it's taken me a while, Doc, to, get over. I have a loved one who, I got 3 minutes left, you guys. I have a loved one who, I broke up with, and I'm still having difficulty processing that. And I really think I may need some help. I need to talk to someone about it. Or I lost a family member, and I'm still, it's been 6 months now, and I haven't bounced back yet, Doc. I think I may need to talk to somebody, right? Or I'm struggling in my family. I have difficulty getting along with others. I don't like to talk to my family members. I cut them off. I don't want to talk to anybody. I just want to be in my house alone and by myself. I think I need to talk to somebody, Doc. Taking the initiative of your mental health is being responsible for yourself. When we walk around and we say, I wish the world was a better place. I wish the world was this. I wish the world was that. The first step starts with us. If we can identify what we need to fix here at home, this home, you guys, this home, heart, body, mind, and soul that belongs to you. If we can fix that, we bring to others a whole person, not a perfect person, not a person absent of flaws, not a person looking to be needed, but a person willing to serve. Why? Because you're whole here. When you're whole in here, you can give out. You can share some of your light. You can give it to others. But when you have a hole here and there's a darkness, you're like the black hole. You swallow up everything that comes into your path. And so when people start wondering, well, I don't know why I can't have a decent relationship with my family or my friends or my coworkers, and no matter what I do, I just always am getting into it with somebody or someone. It's a hole there that needs to be filled. There's something going on here that hasn't been addressed. And so seeing your doctor, talking about your mental health, talking about, doc, I think I need to get a referral to see a therapist, someone who can help me process these things that I'm feeling or give me some coping skills. Ask about cognitive behavior therapy. It's good for changing the way that you think. Negative thinking, negative processes, negative behaviors. It helps us to recognize them. It helps us to identify them and then change them. Okay? We become whole and then we can be happy. You understand? When you get past your fear and past the trust issues about what people can, be there and help you, doctors and psychiatrists and psychologists who can help you, there is a whole new life on the other side of mental illness waiting for you. I won't promise you that there will be perfection every day. I won't promise you that every day you're going to feel like jumping out of bed and running a mile and getting it done. Just like I said this morning when I did my self-care video this morning, I hated getting up this morning. It was ice on the roof, but I forced myself out because when you can master this, you guys, when you can fight the battle here, you can win the battle out here. Okay? And that's half the battle with mental illness. Being mentally strong, knowing when to ask for help. Okay? So I thank you guys so much for coming by my scope. If you're a family caregiver, excuse me, please reach out to me. I'd love to talk to you, hear your story. If I can be of service to you, I'd be more than happy to do so. My website is hamaji.org. Once again, my name is LaShawn, and I'm the founder of Hamaji. Okay, I'm not just a mental health family caregiver, I'm a mental health survivor. So if you're a survivor and you need to reach out and talk to someone or find resources in your area or find out the best way to talk to your family about what you're going through so you don't have to make this journey alone, reach out to me. I'm going to be previewing a new program I have called Anchor Life. It's a new program that I'll be featuring, and it'll be coming up. I'll be talking more about it as the days progress here in January, but I'm launching in February, okay? And I'm very excited about it because it's going to turn mental health recovery and support on its ear, okay? I thank you guys so much. I appreciate you. And I end my scopes in the evening by saying, may God give us peace as our pillow, and may God bless us real good. Thank you guys. I'll see you later. Bye for now. Uh-oh. There we go. Oh, most times it won't broadcast for me, and now I can't get it to stop broadcasting.